Good morning, ladies and gentlemen. We are about to present the findings based on the data analysis you requested us to do. Based on your objective to determine when to send medical staff across the USA during the influenza season to assist vulnerable population that develop complications and need hospitalization. We used and integrated two data sets for our analysis. Census population from the US Census Bureau, years 2009 until 2017, and influenza deaths by the Center for Disease Control and Prevention. Without further ado, we appreciate your trust and present our findings. Data revealed that the months with the highest influenza deaths are from December to February. We were able to identify vulnerable population. Data from influenza deaths show that the highest death rates correspond to people over 65 years old. There is a correlation between the states with the highest population over 65 years and higher number of deaths in those groups, in that age group. Also, we could identify the 4 states that concentrate the highest number of deaths due to influenza in people over 65 years old. These are California, Texas, Florida, and New York. We consider that the data we have given is insufficient to recommend an adequate number of medical personnel. However, based on data, we can recommend focusing on the 4 states that have the highest rates of deaths from influenza and the vulnerable population. So by focusing in California, Florida, Texas, and New York, and also concentrating in prevention efforts directed to vulnerable population of seniors over 65 years old, we can create a great plan. We also identified that 2013 and 2015 were the years which showed an exceptional peak in the number of influenza deaths in vulnerable population. We believe it would be interesting to have more context to analyze what could have caused that. We applied a formula to forecast influenza deaths in order to try to decrease them or in order to contribute to figure out the right number of medical staff for the coming influenza season. One could read a trend that after a peak year, the trend is that deaths decrease. However, we only had data until 2017. We couldn't find information on the deaths of 2018, 19, and 2020. Additionally, we recommend exploring vaccination as another strategy to decrease influenza deaths in vulnerable population and maybe less costly. I'm going to share with you the public Tableau account in which we have uploaded all the charts that sort of visually explain what I've already told you. And you can contact me anytime if you have further questions. Again, I appreciate your trust and I am looking forward to continue working with you. Thank you very much and have a great day.